Assalamu alaikum. My name is Mohammad Hashid Jilani and I'm from the Department of BS Biotechnology. I welcome you all to my presentation and I hope you are doing well. The topic of my presentation is ketamine, so we'll discuss the basic contents of the presentation and then we'll move forward. The contents include introduction, basic information, the preparation of the compound, the pharmacology of the compound, and health hazards that it can cause. We'll start off with the introduction. Ketamine is a member of the class of cyclohexanones in which one of the hydrogens at position 2 is substituted by a 2-chlorophenyl group, while the other is substituted by a methylamine group. As the definition tells, it belongs to the class of cyclohexanones. So we should discuss what cyclohexanones are. Cyclohexanone is the organic compound with the formula CH2,5CO. This molecule consists of 6 carbon cycling molecule with a ketonic functional group. As the name suggests, cyclohexanone has a ketonic group attached to a carbon atom. It is somewhat similar to cyclohexane, but the main difference is there is no oxygen atom in cyclohexane, but there is a doubly bonded oxygen atom when it comes to cyclohexanone, which is the ketonic functional group. So this is the only difference between a cyclohexane and cyclohexanone. There are 2 less hydrogen atoms in cyclohexanone replaced by a doubly bonded oxygen atom. So we'll move back to the definition. Ketamine is a member of the class of cyclohexanones. We have discussed it, in which one of the hydrogens at the position 2. This is the position 2 of the cyclohexanone. This right here is substituted by a 2-chlorophenyl group. This is a 2-chlorophenyl group right here. This is a chlorine atom at the second position of the phenyl group. That is why it is called a chlorophenyl group. While the other hydrogen actually is substituted by a methylamino group. This is a carbon here, these are 2 hydrogens, and this is a nitrogen forming a methylamino group right here. So the 2 hydrogens at position 2 of the cyclohexanone are replaced subsequently by 2-chlorophenyl group and a methylamino group. So we'll move on and talk about some basic information of the compound, which includes different synonyms like ketamine, DL-ketamine, Ketajet, Catalart, Cl581 base. These are different names and may be used in different industries. Like some of them may be used commercially, some of them may be used in the laboratory, some of them may be used as a brand name for a medicine. When we talk about the molecular name, it is 2-orthochlorophenyl 2-methylaminocyclohexanone. We have already discussed the structure based on this name in the previous slide when we talk about the introduction of ketamine. So we'll move on and talk about the molecular formula. The molecular formula is C13A16, 1 chlorine atom, 1 nitrogen and 1 oxygen atom. We have discussed that the chlorine atom is attached to the second position of the phenyl group, whereas the nitrogen atom is present in the methylamino group and oxygen atom is also present on the cyclohexanone forming a ketonic group. The temperature at which it boils is 703.71 Kelvin. The molecular weight is 237.72 gram per mole, which is, I think, on the heavier side if you compare to the compounds that are present near us like water. The molecular weight of water is 18 gram per mole, which is, I think, 17 or maybe 13 or 17 times less than the molecular weight of ketamine. Now we will discuss the preparation of ketamine. This section here provides the understanding and simple reaction to produce ketamine, and on the other page we had the theoretical explanation of it. 2-chlorobenzonitrile along with cyclopentyl magnesium bromide are the starting compounds. To convert the cyanide of 2-chlorobenzonitrile into carboxylic acid, we reacted with water to form orthochlorophenyl cyclopentyl ketone. These two right here are the starting compounds, and when we add water into them, it forms an intermediate called orthochlorophenyl cyclopentyl ketone. Now we will react it with bromine molecule, which causes the formation of bromoketone along with the elimination of hydrogen bromide. As we add a bromine molecule, one of them takes the position of hydrogen, and the hydrogen that is removed react with bromine ion actually to form a hydrogen bromide. To convert ketone into methylamine, we react with methylamine, which further will react with water, resulting in the formation of a very complex intermediate called 1-hydroxycyclopentyl orthochlorophenyl ketone and methylamine. Then this intermediate is heated, resulting in the formation of our compound which we require, which is ketamine. Now we will discuss the pharmacology of ketamine. Ketamine is a non-competitive and methyl D-aspartate shortly called the NMDA receptor antagonist. The non-competitive here means it does not bind to the active site of the enzyme, it binds somewhere else. Whereas a receptor antagonist means it works against the receptors. If it was a protagonist, it would have worked for the receptors or with the receptors, but it is an antagonist. NMDA receptor antagonists are the class of drugs that may help treat Alzheimer's disease, which causes memory loss, brain damage, and eventually death. This disease, called the Alzheimer's disease, is very common in fighters, mainly the MMA fighters, which take blows on their head frequently, and when as they get old, the brain damage leads to certain problems like brain damage, memory loss, and eventually death. There is no cure for Alzheimer's disease, but some drugs like ketamine may slow it down. Also disrupts neurotransmitter glutamate. Glutamate is involved with learning, memory, emotion, and pain recognition. As we know, neurotransmitters are very important for the functioning of nerve impulse, for the passage of nerve impulse. Your brain has billions of nerve cells called neurons. They pass electrical and chemical signals back and forth to process information or tell other cells in the body what to do. The chemicals that carry those signals are neurotransmitters. One of these is glutamate. So, glutamate is a type of a neurotransmitter. When it's passed from one neuron to the other, it attaches itself to the new cell by using what known as a NMDA receptor. That means there is a specific kind of receptor called the NMDA receptor, which is the only receptor that allows glutamate to attach to the other cell. NMDA allows glutamate to connect to a cell like a boat tying up to a dock. When glutamate is docked at an NMDA receptor, it passes calcium into the cell, carrying the electrical or chemical signal to the last step. This is important for learning and memory. If you have Alzheimer's disease, your cells can make too much glutamate. When that happens, the nerve cell get too much calcium and that can speed up the damage to them. NMDA receptor antagonists make it harder for glutamate to dock, as NMD is required for the passage of glutamate to the next cell. If we use drugs like NMDA antagonists which work against the NMDA receptors, we can decrease the amount of glutamate which causes damage when it is in the case of Alzheimer's disease. It has a half-life of 10 to 15 minutes. The half-life of a drug means the time it takes the half of the drug to be removed from your body via urine. Secondly, the drug distributes into peripheral tissues with a slower elimination half-life up to 3 hours. Whenever a drug goes into the tissues, it takes a way longer time to come out as compared to when it is in the blood. Undergoes hepatic metabolism and it is excreted in the urine. It is related to phencyclidine. It is another compound but has less than 10% of the potency of pure PCP, but it is very less potent as compared to pure PCP. Now we will discuss the health hazards. This includes the short-term problem as well as the long-term problems. Short-term problems include problems with attention, learning, memory, dreamlike states, hallucinations, dangerously slowed breathing, raised blood pressure, loss of memory. When it comes to the long term, ulcers and pain in the bladder. Ulcer is a wound that is formed in the stomach. Kidney problems, stomach pain, depression, poor memory. The poor memory or the loss of memory is associated with short-term loss as well as a long-term loss. The most common side effects associated with ketamine when used medically are nausea, vomiting, dizziness, diplopia, which is the double vision, distortion of the image or distortion of what you are seeing, drowsiness, dysphoria, and confusion. There is also a risk of HIV, hepatitis, and other infectious diseases from the shared needles. So, shared needles or needles that are used by any other person should be avoided. So, that was it for the presentation. I thank you all for listening. Thank you so much.